The pre-kindergarten screening exercise PKSE for infants starting kindergarten in 2024 will be introduced by the Department of Education. The exercise, hosted by Special Education Unit, focuses on children in their final year of preschool. Skilled educators record whether these abilities, which are expected in children of that age, are present or absent in the child, and the receiving school can subsequently assess the documentation.
The screen is a standardized instrument that will identify the skills that are demonstrated by these students. And if we discover that skills in the area of language development, movement, gross and fine motor movement, ability to respond to simple questions and instructions, things of that nature, if we discover that any of these are missing or not demonstrated, we document that, and all of the information that we gather from the screening activity gets handed over to the school where the child is about to begin.
The PKSE aids in determining the areas where children need support and their strengths. The effort seeks to maximize everyone's achievement in school by identifying and addressing the needs of the youngest students in the educational system.
We encourage parents also not to put any pressure on the child. This is not a diagnostic assessment. There's no way that a child can fail the screening activity, and the results of the screening activity will not prevent the child from entering kindergarten. It is just a way of gathering information on the child and making that available to the school in advance so that the school can be prepared and know what additional areas of support to give to children.
The screening activity will go on for a period of 3 days. It is recommended that parents and guardians take part in the PKSE.
The screening activity will be from June the 10th to the 12th. So 3 days of screening, but each child will only attend 1 day. We will be publishing information indicating where the screening activity will be happening, depending on which school the child intends to attend in September. And they will only need to be there for 1 day, for part of the day actually. We encourage parents to ensure that when you come with the child, to bring the child's health card. It is very important as part of the overall screening activity.
Dale Sagis, Education Officer within the Special Education Department, notes the activity is not a means to diagnose children with special needs, but serves as a means to help improve any one particular area that both the parent and teacher may need to provide extra attention so that the child is not left behind.
At the end of the activity, we would give advice to the parent and guidance as to what it is that they can do at home to boost the child in that particular domain, that particular area where we discovered that the child's performance was not as expected for that age range. But again, we want to remind everybody this is not a diagnosis, so there's no child who will come out of the screening activity saying that there is a disability or anything of that sort. What we are looking for is areas that the teacher can put emphasis to ensure that the child is not behind other children when they start kindergarten.
The education officer says this early identification has been proven to prevent small delays in development from mushrooming into larger gaps in learning and achievement. Furthermore, it is the department's ultimate goal in this effort to ensure maximum school success for all. For Choice News Now, I am Chelsea Austinay.